Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Bareback sex. Is it safe to go condomless? Bareback sex is a term mostly used to describe men having unprotected, condomless, anal intercourse with men, but it is also sometimes used to refer to any kind of penetrative sex without a barrier. /r/n/r/n Bareback sex increases the risk of getting HIV, human immunodeficiency virus, and other sexually transmitted infections, STIs, so it is important to learn what precautions you may need to take if you wish to have it. /r/n/r/n The term bareback sex or barebacking refers to having penetrative sex without the use of a condom. This term was originally used to refer to men who had condomless sex with men with an awareness of the potential risk of HIV exposure. It's slang commonly used in the LGBTQ+ community and relates to riding a horse without a saddle, also known as riding bareback. /r/n/r/nTheterm bareback may also be used to refer to condomless vaginal sex. /r/n/r/n Condomless sex increases the risk of human immunovirus, HIV, infection and several sexually transmitted infections. /r/n/r/n Since no protective barrier, such as a condom, is used during bareback sex, there can be a higher chance of getting HIV. This is especially true for men who have sex with men, MSM. In 2021, MSM made up 81% of HIV cases in the United States. /r/n/r/n Because the rectum's lining is thin and easily injured, it's easier for cuts and tears to develop during anal sex, which makes for easier transmission of HIV. Because of this, there is a higher risk of getting HIV from bareback sex than other types of sex, especially for the receptive, bottom, partner. /r/n/r/n The inserting, top, partner is also at risk, as HIV can enter the body through the opening of the penis, urethra, or through cuts, abrasions, and sores on the penis. /r/n/r/n Women are also at risk of getting HIV from condomless anal sex. Although only 18% of new HIV cases in 2018 were among women, the risk of getting HIV increases for women who have condomless anal sex, especially if they do so with MSM. /r/n/r/n Bareback sex can also lead to other types of STIs, such as /r/n/r/n Bareback sex increases the risk of getting HIV and other STIs for women too. The rectal lining is more delicate than the vagina, making it easier to transmit HIV through cuts or anal fissures that can happen during anal sex. /r/n/r/n Like men, women should be cautious if they plan to engage in bareback sex, especially if their partner is a man who has sex with other men. /r/n/r/n There is a lower risk involved in barebacking if consenting adults know that they are not infected with HIV or other types of infections. Many people find bareback sex to be more pleasurable and exciting than protected sex. They enjoy the skin-to-skin contact and feel that they can bond more closely with their partner. /r/n/r/n Barebacking may also provide an incentive to remain monogamous when both partners are committed to the relationship. /r/n/r/n Finding the right condom may allow you to experience full sensation. Some condoms are designed to make sex more pleasurable. Textures like ribbing and studs, colors, flavors, ultra-thin materials, and special lubricants can all increase pleasure and sensation for both partners. /r/n/r/n Although it may seem that talking about your sexual and medical histories before barebacking can be dull or ruin the mood, a frank conversation can keep you and your partner safe from infection. /r/n/r/n The hookup culture sometimes seen in dating apps and late-night clubbing is risky if precautions aren't practiced. People infected with HIV can appear symptom-free, so thoroughly talking with your partner before engaging in bareback sex is essential. /r/n/r/n communication is a key component of safer bareback sex. This includes getting tested for STIs, communicating openly about STI status, and setting expectations with your partner. /r/n/r/n Unless you and your partner have never engaged in any type of sex act, then STIs are a possibility, and a talk about status and testing needs to happen before having unprotected sex. /r/n/r/n It is important to routinely get tested for STIs and share your status with your partner. It can be difficult to talk about such things with somebody you may not know well, but it is important for the safety of everyone involved. /r/n/r/n Along with being tested by a healthcare provider, there are also at-home STI tests that can be a great option to take care of your sexual health from the privacy of your own home. /r/n/r/n Also, even if you and your partner are both HIV positive, bareback sex may still cause further infection. There are different strains of HIV. If your partner has a detectable load of an HIV strain that is resistant to HIV medication, there is a possibility of you getting it. Be sure to discuss your HIV status and treatment thoroughly with your partner. /r/n/r/n While most STI tests are highly accurate, false results can happen. It's possible to get a negative test result and still have an STI. This can also happen if you test too soon after exposure to an STI, or if you were re-exposed after you were tested. /r/n/r/n That said, it's important to talk to your healthcare provider about the types of STI testing you may need, and how often you should be screened. /r/n/r/n Discuss boundaries and expectations with your partner, especially if it is your first time together. Clarify if either of you, /r/n/r/n Remember, you and your partner have the right to change your minds about having unprotected sex at any time, regardless of STI results. /r/n/r/n There are several ways to lower your risk of HIV and sexually transmitted infections. /r/n/r/n Abstinence. The only sure way of preventing the sexual transmission of HIV or other STIs is through abstinence, avoiding anal, vaginal, and oral sex altogether. /r/n/r/n Condoms. If you want to engage in sex, the safest way is to use a condom. When used correctly, condoms can significantly reduce the risk of getting HIV and other STIs. In addition, using lubrication, especially for receptive partners in anal sex, may reduce friction and irritation, which can lessen the risk of getting a tear inside the rectal lining. /r/n/r/n Research shows that HIV-negative men who use condoms when engaging in sex with HIV-positive men can reduce their risk of getting HIV by 70%. /r/n/r/n Medications. You can consider taking preventive medications, especially if you don't have HIV and plan to have bareback sex with someone who has or may have been exposed to HIV. /r/n/r/n If you have HIV, it's important to get treatment. By maintaining an undetectable viral load with antiretroviral therapy, there is almost zero risk of transmitting the virus to a sex partner. /r/n/r/n If you had bareback sex and think that you may have been exposed to HIV or other STIs, see a healthcare provider as soon as you can. For HIV, post-exposure prophylaxis, PEP, uses medications to prevent HIV infection if an HIV-negative person is exposed to HIV, and it requires a prescription. /r/n/r/n PEP is usually given within 72 hours after exposure to HIV, as HIV can develop quickly within 2,436 hours after infection. /r/n/r/n Your healthcare provider will probably recommend STI testing to see if an infection has occurred. If so, they will provide a treatment plan for the specific type of infection. /r/n/r/n For example, in the case of an HIV infection, antiretroviral drugs are used to stop the virus from multiplying, which can lessen the viral load to a point at which it is undetectable in the body. /r/n/r/n bareback sex can be a pleasurable form of sex. But with any type of condomless sex, the risk of getting HIV and other STIs increases greatly. To ensure the safety of you and your partner, talk with your partner about your sexual history and current HIV and other STI infection status before engaging in bareback sex. /r/n/r/n You can also consider and discuss the use of PrEP and doxyPEP to reduce the risk of bareback sex and STI transmission. Your healthcare provider can explain your treatment options. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.